News Radio, 1120 KPNW. All right, so the sign-up season has hit for health insurance under the Affordable Care Act, a.k.a. Obamacare, a.k.a. what is this? You're telling me it's going to cost me 25% more? You can call it that. We're in year 3 of the premiums. Nationally, the premiums are going to be going up an average of 7.5%. As we reported on the wake-up call, it was either yesterday morning or Monday, the prices here in Oregon going up on average about 25%. To talk about that this morning, health insurance expert, he runs Benefit Resource Group. He rejoins us on the wake-up call this morning. Danny O'Connell here on News Radio 1120 KPNW. Danny, thanks for being with us this morning.
Good morning. Thanks for having me.
Okay, so I'm going to just kind of speak from the Oregon side of things here for a second. Some of the highest rates we here in Oregon, like I said, on average about 25% for the what's known as the benchmark silver plan. Alaska 31%. Oklahoma is getting it the worst at 36%. What we were told was, well, Oregon had some of the lowest prices in the nation, so of course it's going to go up 25%, but the prices are still low. What say you?
Yeah, so great question. You know, number one, it's kind of hard to compare state to state because you're looking at who are they insuring and what is that population made up of. So just kind of on a national level scale, you know, if you're a 25-year-old, several years ago, you could get an individual health care policy for $150 to $225 a month. Now that same policy is going to cost you $200 to $350 a month easily, just by the community rating factor alone. So what's happening is you aren't getting these younger individuals who are enrolling. You know, if you think back to 2 years ago, we saw LeBron James on national television encouraging younger people to get in. Well, they didn't. If they didn't want it at $150 to $200 or couldn't afford it at that point, you know, raising the price certainly isn't going to draw more people in.
Right.
So you then look at, well, how is our pool in our state running and with that certain insurance carrier? Then you also have taxes and fees going up every year on this plan, which is adding to the cost. So then the next component of that is if I am eligible for a subsidy, is my subsidy actually going to keep up with this increase in cost? And in 2014, 50% of the people who actually got subsidies actually owed money back. They didn't get that full cost savings.
All right, well, that was in 2014. I mean, what is the forecast for this year going into 2016?
Sure. So in 2014, there were 8 million people federally who signed up to the exchanges and got health care. Out of those 8 million, 6.5 million of them actually had prior coverage that was canceled. So you had 1.5 million net new policies. At the end of the year, they looked, and 700,000 of those were still in force, and there were over 300,000 which were canceled due to citizenship status. So for 2015, we go through, and 11 million people signed up. But with these sustained increases, and we start to see them year over year, you know, you may start to see those numbers go down unless if the federal government just starts pouring on the subsidies, which is going to mean tax increases to everybody.
One of the reasons that was also given for the 25% increase in Oregon, besides the fact that, oh, well, it was the lowest in the nation, was they were saying, well, all the insurance companies lost money on the deal. And so we needed the 25% increase to be able to at least float the insurance companies who, if you will, took it in the shorts. And this, to me, it doesn't look like this is going to be something that's going to end soon with the insurance companies going, you know what, we're really not making any money on this.
Yeah, the construct and the confines that they work under is so restrictive that you see more and more carriers getting out of the market, selling off their block of business. You're going to see more regionalized hospital systems create their own plan so that they know that people are actually paying the premiums. And as you have fewer and fewer choices, it means higher and higher cost. In Texas, Blue Cross Blue Shield took a $400 million loss on 367,000 insured lives on the individual market. So if you are buying an individual plan, here's a big tip for your listeners. You need to go and check the network. It doesn't mean that you're going to have the same network and the same access to providers that you had last year, even if you were new at the same company.
Now, when you say check the network, what's the easiest way that they can do that?
Just when they're shopping online is a good way. Also, calling the providers if you have a specific provider to find out specifically what plans they do take and whether it's a group plan or an individual plan. A lot of times you see carriers that have multiple networks. So if you see one plan from one insurance company and you're getting different pricing on two different places, it's normally in that fine print that you have a much smaller network that you're dealing with.
Are we seeing any changes to the actual different levels themselves, the silver plan, the bronze plan, in terms of things like deductibles and co-pays and co-insurance, et cetera?
Yeah, you are seeing slight tweaks because each year they can increase the out-of-pocket. Up in last year it's $6,350. Now you're looking at $6,800, $6,850 for an individual. So those will continue to go up a little bit each year. And that's one of those hidden rate increases I talk about. You get the premium increase, but now I've got to pay more out of pocket as well.
Any other things that people need to know if they're going about, re-enrolling in healthcare?
So in the short term for this year, what I would say is, number one, really look at your utilization. Everybody would love to have a $500 deductible, but when was the last time that you really went into the hospital? We want to protect ourselves against the big losses. So am I the individual that I live with a chronic health condition and I'm on a lot of name brand medication that I need a richer plan? Or am I somebody who, maybe has seasonal sinus infections, I take generics or I don't take anything, and to get my costs down, I may want that higher deductible, to try to balance out my budget. But really look at that. Really look at the network of providers. If you have a provider that you're working with, have that conversation of who they are contracted with, not just who they take, who they're contracted with.
One other thing, at what point does it become, and I realize that it's illegal, but at what point does it become cheaper for an individual to just go, screw it, I'm not going to get the health insurance, I'm going to pay the fine?
Well, for many people, it probably is less expensive to do that. But the problem here is that people don't realize their fine and their penalty until they do their taxes. So for last year's 1% of your adjusted gross household income. So people, that may be what they're expecting to pay for this year, but for 2015, it actually doubled, 2% per household member up to 6%. Well, you don't know your penalty until open enrollment's closed. So some people may be expecting this penalty, and it's actually double than what it was last year. And then it's too late to sign up.
All right. Danny, thanks for joining us on the Wake Up Call this morning. We appreciate it.
Thank you. Good morning.
All right. You take care. News Radio 1120 KPNW, Danny O'Connell, health insurance expert. He runs the Benefit Resource Group.